I like to show something else now. Let's move to skin issues. Please, Mr. Johnson, if we can play this image, would be great. Let's move to something else. Okay, let's move to another image, and we see this is about a skin disease now, and this is severe skin condition when it's ignored for a long time. This is what it would look like. Okay, so this is it. This is it. So this is a very severe, bad condition, bad skin condition that has progressed all over the body now, or at least most of the body, because the face, amazingly, the face has not been touched. This lesion here, this is, I think, the legs, and you see it's spread all over. It's spread all over the body, sparing the face. And that is now, very severe tinea corporis. We call it tinea corporis. It's a fungal infection now. It's a fungal infection complicated by scabies. So scabies and tinea corporis combine. And how can you get to something like that? By ignoring the disease and let it pass for a very long time. That is tinea corporis right there. That is tinea corporis. That is very severe. So in this condition here, it starts with a small rash. It starts with a small rash that itches. That's how it is. A small rash that itches, and if you look at the lesion carefully, you find that it's a bit raised above the skin and it has irregular borders, meaning the surrounding, the circumference of the lesion has no even borders. It's like irregular borders. And this is how you recognize it. It itches and it has a different color than the normal of the skin, the rest of the skin. This is what we call tinea. The treatment is very simple. But one advice, and this is maybe the only case I will mention a drug name, do not take a drug called griseoflovin. It's a dog. It's no good. It's bad. It has a lot of side effects. We don't touch it anymore. Griseoflovin do not take. The safest drug will be something else that is available, a bit more expensive, but is safe, and it does not cause any side effects to the kidneys, to the liver either. So it's very safe. So what is the advice? What is the take-home message here? The take-home message is when you see a circular-like shaped lesion, and I see it, I see it in the kid's head, it's circular like this, and the hair you start to lose, that is tinea. You may also see it in the skin. You may see it also in the skin folds, like between the legs, under the armpit, especially between the legs. You see it there, and you see the area after a while becomes dark. So this is very much fungal infection. Sometimes complicated by a small bacterial infection or so. So we treat it as such, and we have very good success with that. It's not a problem. It takes a bit of time now. But about 2 to 3 weeks, everything will be gone. But what I always say is, if it's all gone, do not stop the treatment. You must continue. You cannot stop the treatment. You must continue till it's all resolved. Then you're okay. Why I'm saying that? Because when we have such infected cells on the skin, okay, and infected cells will contaminate the neighbor cell, and the neighbor cell will contaminate the neighbor cell, and so on and so forth. So now we have a contaminated cell. I put the cream, I give the tablets, this cell, I clean this cell. This cell becomes now dead, but it's in the top layer of the skin. That's why I always prescribe a scrub, a special scrub that has the medicated scrub that you wash with. So you put the cream at night, in the daytime, in the morning when you wake up, you put the scrub, you bathe, and all the dead cells will be removed of your body. So I get rid of all the dead cells that contain the fungus, okay, that contain the microbe. The following day I do the same thing. The following day I do the same thing. So why I say that treatment should take about 45 days, 1 month to 45 days, because if I leave only one cell infected that I have not taken care of, that one infected cell will contaminate the area where the nearby skin tissue, and that will cause a problem for me. That will cause a problem for me whereby the skin is being reinfected again. So hygiene is very important. The bed sheet that you sleep on has to be changed, boiled, and ironed every day. You cannot sleep on the same bed sheet twice, meaning today I sleep on it, tomorrow I have to change it. By the same token, the pillowcases So anything that touches your skin, let me be more unique. Anything that touches your skin must be boiled iron, so we don't reinfect you again. By the same token, every member in the family has to also follow the same hygiene, because if one member of the family is infected, most likely the rest will also be infected. So we must apply strict hygiene. What is that? That is boiled clothes, iron clothes. After you boil them, you wash them, you iron them, and then you don't, any clothes that touches your skin, anything that touches your skin cannot be there for more than 24 hours. You must change them all the times. And whenever you change, you boil, you iron, you make sure it's disinfected very well. And that's how you get rid of that skin infection. It is very common, and I already showed you. It was really my intention to show you the complication, how your skin will get to if you ignore what I'm telling you. Okay, I think we'll stop right here. That is enough